I'd probably say first things first, getting into dental school is a great achievement. I say it to Afif because he's just got in, well done. It may not be what you expect. Once I'd exhausted every game on the planet, I thought let's do the YouTube. And as long as you manage your time well, you can do a lot. But you should absolutely not just leave your dental degree with those 3 letters after your name. That's what I say to everyone as a bit of advice, is do something else. If you're trying to reinvent the wheel and you're 18, 19, 20 years old, you're not going to be very successful. You only truly know how to drive when you get your car and you're out there. It's exactly the same in dentistry.
What do you think was the biggest shock that you had going out of dental school and into the real world of dentistry?
I'll say this in a very careful way. The standard of work that you're able to provide on the NHS. A lot of dentists, unfortunately, get really stuck in the NHS and have quite difficult careers, which is a shame. To be very frank with you, it's not easy because it's not cheap. Like, for you to continuously improve yourself, this is bad, all right? My time is worth nothing at the moment because
We've been speaking about your experiences in dental school, right?
Okay.
And now we wanted to see if you've still got it. So,
right.
we've got some questions here.
Building a startup in your first year after graduating dental school is insane. Building it up to a valuation of £1 million while still practicing dentistry is even crazier. And that's exactly what Faris, our guest for today, did. A big question we had was, what does it take in the years prior to build the skills in order to do what Faris achieved, which we'll uncover by diving into his story. How did a dental student YouTuber turned co-founder brave the real world of dentistry and achieve such heights in his early 20s? And how can you do the same?
Hello and welcome to the Young Dentist podcast. Here we ask those at the forefront of dentistry who've been there and done it all the questions that you guys, young dental professionals and dentists and dental students, want to hear. Now, my name's Fahim.
And I'm Afif.
And today we've got Faris with us. How are you, man?
I'm doing great. Thank you for having me, guys. I'm really excited to be chatting away on this podcast.
Yeah, brilliant, man. I mean, I think you've got more experience than us in front of the camera anyway, man.
Yes.
I remember when I first went into dental school, I used to watch your videos, honestly, man.
I guess they work.
You got in the end.
We wouldn't be sitting here otherwise. But yeah, man, I guess with you, I want to take it back to the start, right? I want to take it back to dental school. So what was it like getting into dental school? And then what was your experience of dental school?
Oh, great questions. I'd probably say first things first, getting into dental school is a great achievement. I say it to Afif because he's just got in, well done, because it's a lot of hard work. It's a headache. There's a lot of kind of, things that you have to do that no one tells you about. So it's a challenge. So I'll say one thing, I was very happy when I got into dental school. I did post on my LinkedIn about my kind of dental school story, which was quite funny. Like on results day, I nearly didn't find out my results, and I kind of got contacted by my school to be on TV. Yeah. And I really thought I was going to be one of those compilations where it's like, like Egyptian boy fails his A-levels and doesn't get into dentistry.
Gets shipped out of the country.
But thankfully it was great. And yeah, so the entire experience from start to finish has been very interesting. When you're a dental student, you start to really pick up on what dentistry is all about. And it may not be what you expect in the sense of, we kind of get clowned by the medics, especially at King's. It's, got a massive medical school. So, you guys aren't real doctors or, it's an easier degree. But your first few years are, very anatomy focused. There's a lot there that you need to learn to get a greater understanding of the body. And as you go through that dental career, it's quite interesting to see your skills improve. And then once you're out, and I'm sure we're going to talk about it, you start to get another realization where, like, okay, I actually knew nothing at all, even when I was at dental school. So, yeah, but overall, I love the career. I really enjoy it. I enjoy my time at dental school, and I'm happy I picked it.
Awesome. And then Faris, you mentioned how getting into dental school itself is quite a process. Is that what inspired you to set up a YouTube channel?
I'll be very honest. That's not the reason that inspired me. The actual reason was that I was bored during COVID. So it was more of a avenue to explore as a result of COVID and being stuck at home. I think I was learning about dentures, and you'll realize how difficult this is when you start them soon online. Like I was being told how to do a jaw registration, like things that are very kind of tangible online. So once you get through that, you start realizing, okay, I want to do something else. So once I'd exhausted every game on the planet, I thought let's do the YouTube. And it did call back to my experiences, applying to dentistry. I was very fortunate that I went to a grammar school from a secondary school, like a kind of selective comprehensive for my sixth form, but there's a lot of opportunities that aren't clear. So that kind of fed into the decision to start a YouTube channel and start teaching people how to get in.
Yeah, 100%. And I mean, dental school, like I know this, I've just come out of my first year. I can't imagine what it's like second, third, fourth year.
Yeah.
It's really time consuming, right?
Yeah.
There's a lot to learn, and kind of balancing that alongside your YouTube channel and anything else that you did? Was there anything else that you kind of went into that you had to juggle
Yeah.
alongside dental school, and what do you learn from that?
Yeah, so dental school is uniquely placed because it's not all just theory, like we discussed. So you have a lot of practical elements, and there's certain things that you can't just learn in a textbook, and it just takes time to hone in. Like, when you're doing your crown prep, so you're doing a filling for the first time. I still have the picture of my very first one, and it kind of looks like a blob that has, like a cross in the middle. So, we all start somewhere. But in terms of juggling time, it all comes down to priorities. So in my head, it was identifying what do I actually want to get out of this degree. Do I want to leave with these 3 letters after my name, which is BDS? Or do I want to be able to say, okay, I did this, 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 and this? So in all reality, yes, it's hard to juggle, but there are ample opportunities for you to explore as a dental student. And as long as you manage your time well, you can do a lot. So, whether it's doing the YouTube, starting my own podcast that I had, different cultural societies, businesses, whatever, you can do a lot alongside it.
Yeah.
You just have to make sure you don't forget the aim, which is to make sure you get that DR at the start of your name. So, yeah, but it can be done. You just have to be smart with your time.
Yeah, 100%. And would you recommend that dental students kind of also explore other avenues in terms of building their skills outside of just the clinical scope whilst in dental school? And what benefits do you think that might breed, like having left dental school and gone to start off your startup, which we'll talk about a bit later? Yeah,
really good question. I'd say the main thing is and I've said this on kind of different mediums and podcasts, is I kind of think of my life as a game. It's just the easiest way. So I kind of think, when you play a game, you have your stats, you have your strength, your speed, intelligence, whatever you want. My intelligence all the way to the bottom. So, you have all these different stats that you're trying to boost up. And that's how I think about my time at dental school or in life in general, where you identify, okay, well, I want to develop this skill. It may not be specifically clinical. I may not have the prettiest composite or the best crown prep, but now I have sales skills or marketing skills, or I've done something that is going to add value to any role that I decide to pursue. So whenever I look at opportunities when I was at dental school, the first thing I set as kind of like a tenet is my time is worth nothing at the moment, because at the end of the day, you're a student. So I'm going to take on every opportunity I can. And then with time, I'll start realizing, okay, this was good, this wasn't so good. Yeah. But you should absolutely not just leave your dental degree with those 3 letters after your name. That's what I say to everyone as a bit of advice, is do something else. And it doesn't have to be something monumental. You don't need to build a company while you're at dental school. You don't need to do anything exciting, but just make sure you're doing something a little bit different.
And Faris, you mentioned you should get yourself out there and learn these skills. You mentioned marketing there as well. How would you recommend a student, because it can seem quite daunting at times, right? How would you go out and find these opportunities? How did you personally do that as well?
Yeah, so marketing is just one I say because the barrier to entry is very, very low. You've seen enough people on, Instagram, TikTok. It's fun to do as well as a dentist, because we've got such a visual career. But so I'll kind of answer it in 2 parts. When you think about what you want to do, the first question you ask is, will I enjoy it? So don't make a dental page. Don't become, put name here dentist or whatever, just because you see your friends doing it. Do it if you enjoy it. And the second point, when you're seeking opportunity, well, just look at other industries, see what else is successful, and try and copy it and bring it into dentistry. If you're trying to reinvent the wheel and you're 18, 19, 20 years old, you're not going to be very successful. It's best off to kind of still like an artist. So take different concepts from different fields that you see and apply them to the career that you're in. So for me, I looked at blog writing as a big one. When you go on any YouTube, you're like, learn these 10 skills, like, do your copywriting or do your drop shipping. So I started a lot of my kind of learnings and income came from just writing blogs for different companies. So yeah, you just find something you enjoy, find the value by seeing it work in another industry, and then just bring it into dentistry. That's probably the best way. And seeking opportunities, just get more exposure, put yourself out there, go to events, talk to dentists, talk to interesting people in the space. And if they say that you're driven, even if you have no track record, they will give you opportunities.
100%.
Awesome. And rounding off the chapter of dental school, I think Fahim has a bit of a surprise for you.
Yes, we have got, well, I think we've been speaking about your experiences in dental school, right?
Okay.
And now we wanted to see if you've still got it. So, we've got some questions here that we're going to ask you.
This is bad, all right?
Okay, so these are from your first year of dental school, so it shouldn't be too difficult.
Yeah, that's what they all say, mate.
Yeah. We're going to start off really easy, and then I'm going to hit you with like a sucker punch. So, first of all, right, which tooth has 5 cusps?
Cusp of carib belly, you're going to have your upper right 6.
Upper right 6?
Or 7. Upper right 6 was, well, my upper right 6 is 5 cusps.
Okay.
It can be upper right 6 or upper right 7 theoretically.
Okay, so I'll give you, yes, technically.
Or you can have your lower right
Yeah,
six as well.
okay, yeah. Correct, right.
Don't know why. Maybe I went to that because
Yeah.
I've got 5 costs on mine.
Okay, so that's one. And that actually took out my second question, which is which tooth has the cusp of
Oh, there you
caramel?
go.
Yeah.
There you go, 2 in 1.
Yeah.
Already had the game.
Okay, now this one, right? There's technically 2 answers for this. But
Yeah.
what is the only muscle in the human body that has an origin but no insertion?
Muscle.
Yeah, muscle.
Because I know with the hyoid bone, it's like just floating around there. Has an origin, but no. Is it the tongue?
Yeah, it is. Yeah, you could have also had uvula.
Ah.
Okay, now these 3 are like slightly more difficult,
here we go.
right? Okay, what percentage of the enamel is made up of hydroxyapatite crystals?
Good question. 92?
Almost.
93?
No,
94?
95.
95?
Close enough, right? Okay, what syndrome causes dry mouth but also affects the tear glands?
Is it Sjogren's syndrome?
Yeah.
Yeah.
Yeah, 100%.
Oh, you're right.
Nice. Now this one is kind of like a tick-up, right? There's 12 cranial nerves. How many can you remember?
It's great. Okay, so you've got ophthalmic,
Yeah.
trigeminal,
Yeah.
facial. I'm going to do this in complete wrong order.
Yeah.
Hypoglossal. No, you've got, I'm missing some obvious ones. So optic.
Yeah.
Ophthalmic, trigeminal.
A few moments later.
Off the top of my head. I'm sure if you give me more
yeah.
time, I can think of more.
I'll be honest, right? I can't blame you because I just finished first year and I've forgotten half of these results. So.
You did pretty well
I
considering.
should have done it in order. You know
Yeah.
what? The good way to... there's a very like rude mnemonic that I
Yeah.
remembered. I've forgotten it now. But, that's how
Quite
you remember
convenient,
it. But I'll tell you after, maybe.
No, yeah, so ophthalmic, optic, oculomotor, trochlea,
it,
trigeminal, abducens, facial,
Yeah.
vestibulocochlear,
Yep.
glossopharyngeal,
That's the one I meant, yeah.
vagus,
Oh, it was Vegas. Yeah, okay,
Yeah.
I was right. Okay. I don't know why I said
accessory,
that.
and hypoglossal.
Yeah. I
Right.
mentioned quite a few, I think. So yeah, I'll take it.
Yeah,
I'll
you
take
did
that.
well, yeah, man.
That'll be a pass at dental school.
Interesting.
Honestly.
So it's good to see you still got that touch and you're not lost at all. But
Yeah.
once again, it kind of goes to show that not all the things you're taught are necessary, right?
Yeah, yeah.
So that's a good pivot into our next topic. You alluded to it earlier, Faris, and you said that a lot of stuff you get taught in dental school is not really the real world. So how would
Yeah.
you say that transition has been into foundation dentistry, and now as you go into the broader practice, how has that been so far?
So you've probably heard this.
Now, before we continue, I want to take a minute to thank our sponsor, Colgate, for making this podcast possible. Colgate is on a mission to support the next generation of dental professionals as they transition from dental school to practice. And they aim to do this through the Colgate Student app. Now, the Colgate Student app is a completely free to use one-stop shop for all dental student education. It contains bite-sized educational content and clips to teach you the skills that you might not have learned in dental school, but that you'll need in real-life practice. The app contains 4 main sections: clinical practice, practice management, having fun, and doing good. It's super easy to use and has something for everyone, no matter which stage in your journey you're at. Now, students and young dentists ask me all the time, Fahim, how do you know what events are happening next? Well, within the student app, there's a specific events section containing exclusive student events, both in person and online, across the country, so you can network your way into those amazing opportunities. All of the content in the app is created by credible sources from across the globe, including the UK's very own University of Manchester, ensuring you have access to world-class support throughout your journey as a young dental professional. Click the link in the description to download the Colgate Student app today. And now, back to the episode.
Analogy a lot with dental school. It's kind of like either you drive.
Yeah.
So when you do your driving test, and it's like, okay, great, I've passed. Maybe you had X number of minors, but you only truly know how to drive when you get your car and you're out there. It's exactly the same in dentistry, because when you're at dental school, the main things that you're learning are going to be things that are foundational. They give you enough information so that you are a safe practitioner. Really critical, because that is the terminology you need to remember. What it doesn't do is make you a good or excellent practitioner. It's just getting you out there, because everyone's at a different level, whether it's skill, whether it's academia, etc. But they're trying to get you out there very safe. When you get into the real world, which is out in the associate life, you learn a lot of things. For example, you might think that you're going to learn about this. You might learn like the optimal treatment for this particular condition is X. Okay, but in reality, that costs this amount, and this patient isn't willing to pay that. So what are you going to do?
Yeah.
So there's a lot of nuances there, and on top of that, there's new concepts for you to learn when you leave dental school. So whether it's going to be biomimetic dentistry, whether you're trying to be a little bit more creative with the way that you move teeth, so not fixed ortho, but things like Invisalign or clear aligners, you have a lot of variation in what you do when you exit dental school. So it's an exciting place to be, but it's also very scary because then also dentistry is one of the few things in the NHS which is paid for, and you have to also learn how to manage that. So yeah, it's tough. It's definitely tough, and that's why dentistry has a high litigation rate. That's why a lot of dentists have mental health conditions. It's a difficult career. So you have to manage it well.
What do you think was the biggest shock that you had going out of dental school and into the real world of dentistry?
Probably say biggest shock would be how expensive everything is in dentistry in terms of materials, and also, and I'll say this in a very careful way, the standard of work that you're able to provide on the NHS. Now, it's good standard of work, but you're trying to do the optimal, perfect, gold standard treatment. Most of the time, that's quite challenging on the NHS. Not because you're a bad person and dentists are money hungry and I want the Porsche in the driveway, but it's because realistically, if I'm having to see 30, 40 patients a day, how am I going to do that and also do perfect dentistry and do rubber dam and put my beautiful composites and maybe my tints? It's impossible. So that was probably the biggest realization and shock, which is, there's a lot that needs to be improved with NHS contracts, and a lot of dentists, unfortunately, get really, 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 really stuck in the NHS and have quite difficult careers, which is a shame.
Cool. So Faris, having said that, what would you recommend and what advice would you give to fifth-year students that are looking to get into foundation training a year from now?
Yeah, so the biggest one is identifying what you're uncomfortable with and just trying to up those numbers. So whilst you're still at university, do the things you don't like. Like I've discussed this in the past, like root canal treatment and extractions can be quite challenging, and you might leave dental school without many done, with many people kind of leaving within 5 to 10 root canals, maybe if they're lucky. So try and expose yourself to a lot of things, and then when you get into your foundation training, make sure your theory is up to scratch. So make sure you know how to do everything to a basic standard, and you keep pushing the envelope, keep doing the things that make you uncomfortable, because this is the only year where you're protected. After that, the second you're in associateship, you are out there. Good luck. If something goes wrong, it's on your head. No one's there to protect you. So yeah, it's all about make sure you experiment, make sure you put yourself out there, and don't get too nervous. And I'd probably say one extra bonus tip is get some loops. Everyone says, oh wait, no, just get them as soon as you can. If you can afford them, get them. And you don't need to get the most expensive pair. I generally give recommendation that you shouldn't go anything below like a 4X for your first pair of loops, because once you start, you're then going to be like, oh, I want the next size up and the next size up. So yeah, just get some loops.
I mean, you mentioned like dental school prepares you to be safe, right?
Yeah.
But if you want to get to the next level, if you want to become like an exceptional dentist, how important do you think like continuing your learning outside of dental school is to that?
Yeah, it's critical. You're not going to be a fantastic dentist without extra education. You just have to do it, because the UK is very uniquely positioned whereby you don't need to go back to university to have a greater level of exposure to specialist-esque treatments. You can be a dentist with, so for young people that don't know, like you can be a dentist, just general dentist, you can be a dentist with a special interest, which means you've had some form of education that's built on your prior knowledge of dentistry. So you might get a special interest in oral surgery, and you'll get that by doing like a 2-week oral surgery course where you learn how to do really complex procedures. And then your kind of final route is to be a specialist, where you've gone through like a formalized training route, and at the end of it you get put on a specialist register and you're a prosthodontist or an endodontist, etc. But yeah, you have to put yourself out there, you have to experiment, and to be very frank with you, it's not easy, because it's not cheap. Like for you to continuously improve yourself, you're investing in yourself. But there's this interesting kind of concept where I think it's Alec Hermosi, where it's like, you want to invest in the SNME like 500, not your S&P 500, because you want to make sure that your education is tip top for you to be able to provide high quality dentistry. And set your targets. Like, what do you want to do? Is your target to just make the most amount of money possible? Is your target to do the highest form of treatment possible? Get those priorities straight, so that when you get out there in the world, you're able to kind of track yourself over time.
I see. And Faris, you mentioned how you've got to invest in yourself and choose the right course for you, right?
Yeah.
So how would you recommend someone looking to get into these courses? How do you select which course to do, really?
I think it's nearly an impossible choice, because there's just so many out there. The main things that I look for is just going to be your in-person days, the support that you have, recommendations, and I guess the final thing is you're doing something that you can see yourself applying in practice. Don't do an aesthetic course if you're not working at a practice where you can do aesthetic work. It's stupid, because you're not going to learn anything, and unless you apply that knowledge, you will forget it. And again, take recommendations with a pinch of salt, because think about it, if a dentist dropped like £10,000, £15,000 on a course and it wasn't good, they may feel like, oh no, actually it was decent, because I spent so much money on it, it's got to be good. And maybe look at the portfolios of people that you respect and speak to them, be like, oh, what course did you do? And learn from there. But if you want me to kind of give you the TLDR, courses are generally quite good. Make sure you get a good qualification like a PG Cert, PG Dip. And if you think you're going to learn something in 2 days, you probably won't, you know. Try and get something that's a little bit longer to boost your skills. And that 18K, 20K, whatever, will pay itself back as long as you're going to bring the patients in. So don't stress too much about the cost.
I mean, you touched on something there as well, which is that kind of getting in touch with these people and and speaking to people. How important do you think networking is as a dental student, as someone who's going into the wider world of dentistry, and how did it personally benefit you?
Yeah, so networking is an interesting one. You don't want to be the type of person that's just talking to everyone for the sake of talking to everyone, but you want to get your name out there, which is the same thing about kind of having your social presence, whether it's going to be on the work that you do, whether it's like social media, etc. But I do think networking is important. You know, it's all about understanding who's in the field, because at the end of the day, the people that are going to hire you are dentists that are just a few years ahead of you, you know. So it's absolutely critical to get yourself out there. Again, this is, and I like to preface this a lot because some people say, well, I was fine, I didn't network. It's like, yeah, you can also just be finding, but that's, you're putting things in the hands of luck. Do you want to base your career in luck, or do you want to give yourself the opportunity to do some great things? So yeah, networking is a good opportunity to kind of get out there, especially because a lot of young dentists, everyone knows it, no one wants to talk about it, no one wants to do NHS dentistry. Okay, I wouldn't say I'm in that camp. I still think NHS dentistry has its place, but you know, if you're looking to do private dentistry, you need to be placed in the field. You need to know people as well, so that you can be given those interesting opportunities that may not show up on Indeed or Dentist for Dentists. So yeah, in short, very important to network while you're at dental school.
Interesting. And Faris, you mentioned earlier on, whilst you were at dental school, you had that podcast of yours.
Yeah.
How do you think that, how instrumental was that in your networking journey, and how helpful was that?
Oh, it's extremely helpful. When you're doing a podcast, it's a great opportunity because it marries two things that dentists like. One, we like talking about ourselves. And two, it gives you an opportunity as a student to speak to dentists that may not usually have the time for you. And the most value you get out of a podcast, which I'm sure you guys will see, is not the podcast itself, but the 10, 15 minutes before and after, where you actually get to probe that person once you've kind of built some rapport and learned more about them. So, you know, the podcast was extremely instrumental in any of the success I would, you know, perceive to have. And I think it's great to do one if you're interested in it. I keep saying this because a lot of people are like, oh, you know, they feel under pressure. I've got, you know, you don't have to do anything. Like you can do your BDS and still come out and make good money and be very happy. But you just kind of want to stack your deck with all these different things that you do to boost your chances of getting what you want.
Interesting. And Faris, lots of our audience are dental students out there.
Yeah.
So what benefits did you have, you know, firsthand from networking? Did you get any shadowing opportunities, or what pathways did that open up as a student?
Yeah, it will open up shadowing opportunities. It helped me land a job. It helped me just speak to dentists that I thought were cool, which is always great. Like you're entering a profession that you're dedicating, you know, whether you want to agree or not, but probably about 40 years of your life to. So you might as well try and learn the people that are in it. We're not a very big profession. You know, I think there's 10 times the amount of medical graduates as dental graduates here, and it's growing. So get to know the people around you, you know, and opportunities will come. But yeah, I think that the opportunities I had were generally kind of mixed, some clinical, some non-clinical, but all in all a positive experience.
Brilliant, man. And now we want to move on to kind of your startup, right? So you've done all this dental school, and while you're in dental school or while you're transitioning, you've come up with the idea of Oralize.
Yeah.
So kind of walk me through what came into your mind to kind of start that, what pushed you to start that?
Yeah, it's all kind of like a butterfly effect where, you know, as we were talking about, like by doing things at university, like, you know, the social media, the blog writing, that got me noticed by a company called 32Co, which is a clear aligner brand. They're a startup as well, a little bit later stage than us. And they offered me an opportunity to do some social media work on a freelance basis. I was like, actually, in a reverse, give me a job instead. It worked, and I ended up working there in my final year of dental school. From the opportunity, I then saw how exciting startups can be, how interesting they are, and how they kind of filled a bit of a void that I wasn't sure how to fill before, you know, which is that kind of entrepreneurial side in dentistry where you can't really do much while you're at dental school without upsetting people, you know, in the academic sense. So it gave me an opportunity to explore something different. So I was like, okay, let me start my own startup. And look, I've already done things in the dental admission space, medical admission space. Let's do something in that. And that's where Oralize was born, which was essentially a concept where we use AI to analyze interviews and allow students to prepare for their medical, dental, and now job interviews as well. So it's all butterfly effect. It wasn't like I baked this idea when I was in first year, I'm going to do this. It came over time as I started understanding the market and seeing where the demand was. And then we said, okay, let's actually get into this and build something interesting.
I see. And Faris, going into it, I'm sure there's many people in our audience who also want to do something similar, entrepreneurial.
Sure.
What would you say the biggest things that you didn't identify before, the biggest surprise per se that came about as a result?
Yeah, it takes time, and startups need money. Like, you know, that's essentially it. The main thing I always say to people, everyone has a business idea. Ideas, you know, are a dime a dozen. They're not interesting. Well done. Okay, you thought, let's make a new, you know, social media app. It's probably going to flop.
Yeah.
You know, it's not because you're a bad person, but you need to understand that just having an idea isn't enough. You need to have an execution plan. So the biggest challenge for us was identifying how to ensure we're going to have enough revenue, how we're going to be, you know, funding this, because it's a tech-based product. So, and also for me specifically, I'm a dentist. You know, I don't have any technical know-how. I'm not going to code this out and try and build a site. So when you're coming from a clinical background going into something business-minded, you need to work out where your limitations are very quickly, and either find someone to help you do that, or get money from somewhere so you can hire someone to do it for you. Those are your two solutions, realistically. Or learn it yourself, but I wasn't going to learn to code. So.
I mean, we're going to cover that as well.
Yeah.
I mean, how you found your co-founder as well.
Yeah.
But I also wanted to touch on something you mentioned there, which was it gets difficult sometimes, right?
Yeah,
it's hard to pull through. What do you think anchored you to kind of onto that vision, and what can other students or graduates who want to start a startup, what should they be wary of before kind of committing to their vision?
The number one thing, and this is something I've learned actually during foundation year, which is a cool learning, is you need to know your career first. A lot of people kind of, especially young dentists, they're like, oh, I'm going to build something, I'm going to do something. It's like, okay, great, but have you looked at what you can do in dentistry? Like, it's a massive, massive market. There's a lot of exciting opportunities. Why are you going elsewhere? You know, so that's one thing I'd say to people is, it sounds cool to be like, oh, I'm building this, I'm doing this, but okay, startup is a startup. Like, it doesn't actually mean anything apart from something that you can write on a CV. If that's what you're looking for, great. But it's a challenge, it's a business, you need to run it, you need to spend money on it, you need to nurture it, and obviously you've only got X amount of hours in a day where you can do things. It's going to take away from something else, so there's sacrifices that need to be made. But yeah, the biggest one I'd say, especially to young dentists and dental students, is don't keep thinking, oh, I'm going to business this, business that. Understand the market you're in first, really understand dentistry, what opportunities are there, what can I do? Because whenever you look at a business, one of the first things, even when we go to raise money, we get asked is, what's your moat? What's your USP? What's going to make you stand out from the rest? And there's an amazing thing in dentistry. Your USP is, okay, there's only 1,000 of me that get created every year. So there's only a handful of people that can build this. And of those handful, only maybe about 1 to 10% are actually interested in building a business. So you're already ahead of the game. Whereas with other fields, that's a little bit more, variable. You have a lot of people competing for the same kind of portion of the pie. So yeah, you have to be really smart when you're thinking about building something, and you have to forecast out what it's going to look like and what your life's going to look like and what sacrifices you have to make.
I see. And Faris, you mentioned earlier on how money and the funding can be a big barrier, especially when you're starting a new business. How is that process like in actually getting the funding, and what advice would you give to someone on a general level who's wanting to secure that funding? Yeah,
so typically when you're starting a business, and I'm talking about, so the difference between startup and small business is generally based on the scale that you're looking to grow it to and the manner in which you do it. So with a startup, a lot of people kind of have this concept of, I want to raise money. The main ways you raise money for a startup is, one, you can bootstrap it, which means that you increase your income and take money from what you've generated and put it into the business. So Faris makes 5K a month, he takes 2K and puts it into Oralize. And that's the most common thing to do. Your next option is to go to an angel investor, which is a high net worth individual who's like, I want to invest in early companies, because the benefit to them is if you go big, they make a lot of money. And if you go bust, well, they get some tax-free money anyway because they can invest through SEIS and EIS. And then the last few options are the interesting ones, which is like an accelerator or an incubator, which is a program. Incubator being when you have an idea, accelerator, you've got an idea and they're going to accelerate your growth. And they give you money for equity in the company. And the beauty of this, especially from a clinical background, is you get some training, you get some support on the business and financial side, and you're able to kind of rubber stamp your startup and be like, I've been backed by X organization. And then lastly is VC, which is kind of the golden ticket for a lot of people, which is going to a venture capital firm, private equity, whatever it's going to be, and asking them to give you a boatload of money. And usually, because people don't understand this in dentistry, meaning you'll probably quit your job, okay? They're not going to give you money if you don't quit your job. And building your startup from scratch and being like, okay, I've got about 1, 2, 3 million pounds, 10, 20, whatever it's going to be. Now it's time to just go all in and make this profitable. So yeah, that's generally the ways that you can raise money for your company.
And I guess it's all good and well saying these are the ways. How do you personally experience going up to these companies? Because it must have been daunting at first, right? You starting with nothing and then going to them to try and get that. So what was the process like before? What were you feeling, and how did you overcome it?
Yeah, I think there's a few challenges, and I'm just talking from a dentist perspective because no one really talks, like there's not many dentists that will go down this route. So one big issue is you have to make a decision about your career. So for me, I knew if I was going to do this, I would have to do it part-time. There's no way I'm quitting dentistry to do it yet. So you have to bear that in mind. So that already shuts a lot of doors when you're going to raise money, because typically if someone's going to give you a good amount of money, they want to be like, oh, you're working on this full time, right? So that was a challenge. The way that myself and my co-founder went about it was looking at different funds that allowed you to kind of work part-time or on a hybrid basis. So we applied to a few, to name the ones that I remember. So Techstars, there's one I think called Antler, Entrepreneur First. Kings actually has one. Funnily enough, they have an accelerator. It doesn't give much money, but it's not bad. And Y Combinator, which is in the States. So you apply to them, you go through some rounds of interviews. You're probably going to get rejected from most of them. Yet they have like a 1% acceptance rate. And then at the end, they either say, yep, we're going to invest in you, or see you later, mate. So that's how we raised our money. So we got into an accelerator called Techstars. They gave us a fund of cash that went straight into the business, and that's essentially how we keep it afloat, alongside my income and my co-founder's income. That just
Awesome. And Faris, you mentioned you have a co-founder, and recently I saw on LinkedIn that you guys are growing, right?
Yeah.
So when selecting people to work alongside you, what do you look for?
I look for traits. I know a lot of people worry about experience. Like, oh, you need this much. I don't really care about that. I'm 24 at the end of the day. My co-founder's 23. So we can't really go in and say, oh, we need experience. I'm not going to hire someone more experienced than me, yet at least. So we look for people that have the right traits. And typically there's certain things that I will screen for when I want to hire someone. And the number one thing I screen for is their behavior towards failure. So I want to find people that have failed in the past and how they bounce back. What do they do? Because startups are full of failure. All you do is fail. Let's launch this product. Oh, it didn't do very well. Great. Now what am I going to do next? Because some people you'll find when you're kind of talking to them, they only see life in success. They're just like, yep, I've done this. It's like, okay, great. Let's put the brakes. What's something you flopped at? What did you do about it? Because I fail every single day. Like, we do a lot of things that don't work. But I need someone that's going to be able to persist through that. So we look at that kind of ability to fail and recover. We look at kind of grit, which is essentially grinding through it. Again, a lot of it is just getting through pain. And the last and most interesting bit is the aspect of kind of creativity and being independent. I'm not the type of leader that's going to be breathing down you like, you've got targets, do this. But I am the type of person to be like, look, we want to achieve this. You can do it in 1 hour, you can do it in 10 hours. As long as it's done, congratulations. So I just want to look for someone that has that independence and the smart thinking to accomplish tasks. So yeah, that's typically what we screen for when we do our interviews.
Yeah, I mean, you touched on something there as well that I wanted to explore, which was getting knocked down and getting back up. Right? Yeah. I think being dental students, being the kind of the top of your class all your life, and then getting into dental school and then realizing that, okay, actually things are difficult now. Starting things on the side and failing. And a lot of dental students don't know how to deal with that. Yeah. So what advice would you give to kind of dental students and people in general to kind of get over the fear of failure and then also learn from your failure?
I think it's really difficult, because I'd say most dental students fall into that category of having imposter syndrome, and you're kind of like, oh, am I meant to be here? Oh, maybe it was a fluke, or I don't know if I actually work, like there's a lot of doubt that gets sowed into your mind. I don't know why, but it's just kind of how it is. And when you're at dental school, sorry to say, it gets worse, because you're also entering a career where every single step is checked. Everything that you do clinically is checked. You don't really have a lot of autonomy. You're being told to do things in a certain way, and when you do something wrong, it can be disastrously wrong, and you can get sued. So it kind of, you get this amplified by 100. But the way that you typically deal with it is, everyone's a bit different, but have outlets for your stress, work-life balance. I know everyone says it, but you do need some kind of work-life balance, whether it's, and that doesn't mean, by the way, that wake up at 5 a.m., have a cold shower. Work-life balance can be just make sure you take an hour out of your day to just like watch a TV show, just take it easy. And the next one is just accepting reality. You will fail, and you're going to fail a lot. Get on with it. You just have to accept the reality. If anyone that's trying to do something great is going to fail along the way. The worst thing is if when you fail, you just constantly try and seek the reason, and you get fixated, and you're like, okay, I failed. Oh God, I just don't want to do it again, so I'm not going to try anything else. It's like, no, fail, learn from it, do something else. And the philosophy I follow is, if every single decision I made, over this next 6 years now, so until I'm 30, is wrong, I'll still probably be fine. Obviously, unless you commit a crime, don't do that. But like generally speaking, even if everything I do is wrong, I'll probably be fine. So just take the risk, do it. You've got no responsibilities. Hopefully, no one has any kids or is married when they're in their first year of dental school. If you are, no problem. Just take it easy. Ask the wife. But yeah, I just think the best way to do it is have it in your mind that it's going to happen. Just accept it. And failure comes in different ways because, when you saw that kid at school, probably a lot of dental students, were like, oh, I only got a 95, not a 100. To them, that's a failure. But so, to them, it's a failure. So you've got to kind of position yourself in the right way and understand it's going to happen, accept it, just have ways to learn and grow from it.
And talking about advice, Faris, right now out there, I'm sure there are many students watching. If you can say one thing to them, what would you say to this audience of young dentists?
If I could say one thing to them is experiment, put yourself out there, and like we just touched upon, don't be afraid to fail because no one's really watching. No one really cares what you do, again, except if you're committing a crime. So just put yourself out there and, try and be different. That's probably what I'd recommend.
No crimes committed, hopefully so. Faris, what does success look like for you, just to round this conversation off?
That's a really difficult question. I think success to me is built on a few things, but generally speaking, it's a concept based on what legacy you want to leave behind. That's a big thing to me, is kind of legacy. And, when you pass away, what do you leave behind, whether it's for your family, whether it's the representation of yourself that people kind of remember you by. And for me, the things that I sort of battle with are, I want to build something great, but at the same time, I want to be the type of person that's there for his family, that's there for his wife and his kids, and is able to have a life that is fulfilling. Because at the end of the day, we're all going to die. If you have a net worth of 10 million or £1.50, it's not coming with you when you're gone. So I just try my best to have a fulfilling life, be comfortable, and ensure that I do the things that I enjoy the most. So to me, that's what success looks like.
That's brilliant, man. No, it's great to hear. It was nice having this conversation with you.
It was great.
Hopefully our audience, dental students, young dentists, whoever you are, took some value from that. And
Cheers.
Thanks for having you on.
Thank you very much.
Take care. God bless.